Welcome to AM Health Hub Podcast, your guide through the world of advanced cross-border medical care. The life can change in seconds. So it can be an accident, a heart attack, or some, certain crucial medical conditions. In such situations, we just only need the treatment. That's time we need a race against the time. In today's episode, we are talking something that can make all the difference in the critical moment, time, air ambulance services. So today, joining us is the CEO of Qulife Air Ambulance, our AM Health Hub partner, Qulife Air Ambulance Services Group CEO, Mr. Dharshak. In this special podcast, we will explore how air ambulance services will work and what families should know in a crisis, and how this partnership, AM Health Hub and Qulife partnership, is redefining the urgent medical transfer. So, Dharshak, welcome to the special show.
Thank you. Thank you for having me here.
Yeah. So, let's start from this beginning. What inspired Qulife Air Ambulance to start this special mission? Actually, this is a special mission. We can say it's a special mission, right?
Yes.
What is the reason behind to start up for this start?
Right. So before we go into why we started, I'll explain in a simple term what do we do, so that the audience can better understand. So, in a nutshell, at Qwiklif, we do international medical air transfer of patients across the world, from anywhere to anywhere. Given that they cannot travel by normal means, like a normal passenger, if the patient cannot travel, we take care of the complete process across the world. So that is what we do in a gist. Now coming to why we started or how we started is back in 2016, I was studying in Bombay, and my dad was in Dammam in Saudi Arabia, and he had a heart attack. Oh. So at that time, I contacted all possible air ambulance companies. Mm-hmm. And generally, I got two type of responses.
In 2016, right?
In 2016.
9 years back.
Yes, 9 years back. So type 1 were the companies who were really sure on the safety part of my father, but they were extremely expensive. Mm-hmm. Second one were the affordable ones, but while talking to them, I didn't feel the comfort, and they were not sure on the safety part.
They are not confident.
They are not confident themselves. So I saw a market gap, and I had it in my mind back then that when I grow up, if by God's grace I have the chance, I have the enough resources, I will cater to this market gap and give the service to the people who are in need. Okay. So that's how the whole concept of air ambulance or Qwiklif Air Ambulance was started with us.
So you fulfill the gap. The gap means there are commercial side.
Yes.
That was too expensive.
Yes.
And the other side was cheap, but you doesn't get the confidence to work with them.
Correct.
Yeah. So Qulife is fulfilling this gap.
Yes.
So you are providing these services like affordable to the patients and family.
Yes.
And you are giving the safety side also, you are taking care.
Absolutely.
Okay.
Absolutely.
So you say that the safety side. So what are the actions that you normally take for a patient transfer to be in the safe side?
See, ideally, the safety part in this line of work comes majorly from the medical background, and secondary is the logistical background. So as soon as we get an inquiry, our team does the medical evaluation of the patient in close coordination with the hospital, which is arranged by AM Health Hub. We do the medical evaluation either in person or in a teleconference setup, so that everything is in order for the medical air transfer, given that the patient's family decides to go forward. So step 1 is medical evaluation, wherein we are really sure on the safety part. And secondly is the logistical part. Logistical part as in we have to be in close coordination with both the hospitals. That means the departure hospital, arrival hospital, both the airports. If the patient is going by commercial airline, the airline. If it's a chartered air ambulance, the crew of the aircraft. And obviously the ground authorities of the airport. So both from the medical part as well as the logistical part, we have to be 100% sure. In this line of work, there is no room for error at all.
Yeah.
So that's how we make sure that the patient is safely handed over.
Yeah. So I just want to ask you, this medical air ambulance, this term is not familiar with everyone.
Correct.
Right. So the audience have doubts like once a patient need a support from our side, normally they contact AM Health Hub. So once they contacted the AM Health Hub, the patient will be in the hospital.
Correct.
So what is the journey? I mean, can you walk us what an air ambulance journey actually looks like?
Sure. So see, before going into that, I will explain very briefly how medical air transfer works in scenarios wherein medical conditions are different. So ideally, there are two ways to do medical air transfer. One is obviously in a private jet, completely dedicated air ambulance. Second one is in commercial airline. In commercial airline also, there are several ways which we will cover later to do medical air transfer. But ideally, these are the two ways to do the medical air transfer. Now, coming to the answer to what you asked. Step one, as I said, medical evaluation. Once medical evaluation is done,
Medical evaluation means once a patient or the bystander is calling AM Health Hub,
yes,
we will coordinate with the Qwiklif.
correct.
So you send the doctor, Qwiklif crew to the hospital, right?
Yes,
Then
yes.
we will do the thorough checkup,
Correct.
medical checkup with the doctor,
Correct.
right?
Correct.
And we will see the patient as well.
That's right.
Okay.
And also, we will be in coordination with the hospital, get all the reports, medical reports, or if there are any examinations done, the cultural reports, etc., etc.
Yeah.
And we make sure that the patient is safe to fly in either in dedicated air ambulance or in a commercial airline.
Okay.
And based on which the further journey goes on. Then there are a whole lot of scenarios involved in the back end, but from the patient's family's point of view, there is very seamless work done because of the vast network that AM Health Hub carries and also the experience under the belt of Qwiklif. So we make sure that for the patient's family, it is as smooth as possible, as seamless as possible, and as safe as possible. So in a nutshell, we take care of complete bed to bed. That means ground ambulance over here, ground ambulance at the destination.
So from the hospital, we collect the patient.
Yes.
And we collect the road ambulance to the
Ground
airport.
ambulance.
Ground
Yes.
ambulance to the airport.
Correct.
From the airport, we will assist with the doctors to the flight
Correct.
to the destination.
To the destination.
From the destination,
Yes.
again ambulance to the hospital.
Correct.
So our medical team will be there
Correct.
throughout the journey.
Correct. One point I would like to add here is the patient generally won't go like a normal passenger from the terminal. The ambulance starts from the hospital. We before itself take the tarmac access. The ambulance goes inside the airport in the ramp and is ready just besides the aircraft. Given that the aircraft is not ready to board for the patient, we make sure that the airport medical center is pre-booked wherein the patient can rest. It's like a mini hospital setup inside the airport. We'll make sure that the patient can rest over there. Once the aircraft is ready to board, we take the patient from the airport medical center to the aircraft. Same thing happens at the destination. The ground ambulance is ready near the parking bay of the aircraft so that as soon as the aircraft reaches the parking bay, the patient is shifted from the aircraft to the ground ambulance and the security and the immigration process goes on and we take the patient straight to the hospital.
So Dharshak, there are many kind of medical transfers are available.
Correct.
Can you just explain the type of medical transfers and to make aware the audience different categories are there in the commercial side and in the technical side?
Sure. So medical air transfer we can categorize ideally into 4 parts.
4 parts.
One is air ambulance. Air ambulance is basically a private jet with complete ICU setup and the medical personnel will be traveling and also the family can travel in the private jet.
We have in-house.
We have one in-house. Then the remaining 3 comes under commercial airline. So in the commercial airline, under special approvals and after taking special permissions, we can do a patient transfer in a category called commercial stretcher. So it's basically for the patients who cannot sit at all or the patients are in ventilator or on oxygen support but should go from hospital A to hospital B in a complete lie down position. So that is commercial stretcher.
So there we need maybe the ventilation support and everything, right?
Yes.
Maybe. Or
yes.
Must.
Depends on the medical condition of the patient. So equipments and the medical personnel's medical team will be from our side. The oxygen we cannot carry by our own. That has to be taken by the airline, from the airline only across the world. That is the standard category. Then second is medically configured business class. It is normal business class seats, but with special arrangements done so that the patient's medications can be taken. If there are any medical equipments to be taken for the patient, that can be done. And the patient, only condition is patient needs to be able to sit with back support for around 30 to 40 minutes during
30 to 40 minutes.
Yes, during ascent and descent.
Okay.
That's the major criteria for that. And the patient can be on oxygen support and all those things. No problem on that. Even in that scenario, our medical crew will be there and we will take care of the complete process. So third in commercial and final category is something called as medical assistance. That is basically same thing in economy, But under special permissions, we can take certain equipments and certain medications for the patient. This is generally for patients who is having fractures or ladies who are pregnant. For them, we cater in this particular way, medical assistance. So ideally 4 ways.
4 cases are coming. Okay. So as you know that in the last 1 year, we, AM Health Hub and Qwiklif have almost 1,200 plus
Patient
medical transfer we have done through our services.
Yeah.
So can we please give some 3 or 4 example to be connected with the people?
Sure. One I'll give the recent example, the baby case which we worked together. So it was a 4 days old baby, and the baby's condition was very critical, and obviously the parents couldn't afford the private jet, and the baby wanted to be shifted from Dubai to India, and the commercial airline told that there is only 2 particular variant of incubators that they can allow because of the engineering constraints. And we tried everywhere, and through AM Health Hubs network, we got to know that the nearest available one, Hyderabad, from the hospital in Hyderabad, and the hospital very graciously sent the team as well from Hyderabad to Dubai, and then the baby was transferred safely from Dubai to Pune.
Just 2 days back also the parents called me.
Yeah.
The main thing is they lost the hope at that time.
Yes.
I mean, while they call me, not me, our team, I personally in touch with them at the initial stage. They lost the hope.
Correct.
But luckily, I think the child is very lucky.
Yeah.
That time we connected to the hospital in Hyderabad. We almost coordinated with more than 20 hospitals in that 1 hour.
Yeah.
But one hospital had that special incubator.
Correct.
And so it's a team, like it's a mission work. Like I feel like that was a war.
Correct.
On the same day we arrange everything, and the next day the baby flight from here.
Correct.
Luckily, they are very happy.
Yes.
The child is safe.
Yes.
Child is very safe.
Yes.
And do you remember the case that we had done from Africa? The case from for the oncology side.
Yes.
What was that actually?
The patient was in, if I'm not wrong, in Kenya. And I guess very close to Nairobi, in a town very close to Nairobi. And the patient was on ventilator support, and again shifted to be in Hyderabad. It was a challenging part because the Kenyan authorities are relatively slow from what we experience. But again, through AM Health Hubs network, I guess one doctor connected to the airport, some very high level airport personnel, and because of which we got all the permissions and approvals very smooth, and we took the patient from Nairobi to Hyderabad.
Yeah.
And again, very safely, securely, no complications at all. And the patient is recovering very well.
This point that what Dharshak say, I just need to be elaborated with the audience. Like, AM Health is connected with more than 100 plus embassy officials all around the world.
Yes.
We have a special team for that who is dealing with the government officials.
Correct.
So the main concern that most of the people are facing at the time of this medical transfer are the documentation.
Correct.
It is not easy what we think.
True.
When we go for one thing, they for the second document, then the third document.
True.
The people is not aware of this kind of things. It will take maybe 10 days, 20 days only for his documentation.
Of course.
In that scenario, the patient's situation will be vulnerable again and problem.
True.
So in that cases, we can. So because we are used to do this kind of documentation, and we have a special crew for that, for this medical support. Moreover, AM Health Hub is connected to more than 250 plus super specialty hospitals all around the world.
Correct.
And more than 25,000 plus doctors are listed in our, in our portal. So that the time matters.
Correct.
And as I am always saying, your health is the priority, is our priority.
Correct.
Okay.
Correct.
So
even I think even in the Syrian case.
So
we got a call from the family stating we have this patient who's bedridden for I guess 7 months in Abu Dhabi, and we want to bring him back to the hometown Aleppo in Syria.
Yeah.
And the patient couldn't, or patient's family couldn't afford private jet, and there is no airline that as of now that can carry the patient in a commercial stretcher from UAE to Syria. So through, again, AM Health Hubs network, we got in touch with the health ministries of UAE, the Lebanese authorities and the Syrian authorities. And we took the patient from Abu Dhabi to Lebanon and Lebanon to Syria. And after reaching Syria also, or before itself, we knew that the patient's family requested us if you can take the patient to the government hospital. So in Syrian or in Aleppo, the government hospitals generally are not that fast. So already the patient's family was in touch, but they were again dealing. But again, through AM's network, we got it done very fast. I guess it was within 24 hours we got the acceptance letter and everything done. And the patient is now in Alipo General Hospital.
He's healthy now.
Yes, he's healthy.
The patient is healthy
Yes.
now.
Yes.
So it's like that. So many cases that we have done in our last, if you take in the last 1 year history, there are so many cases. And 99% are critical issues.
Correct.
Critical issues.
Correct.
And even some, air ambulance companies, they denied, they can't do on that time also. We take that as a challenge.
Yes.
And with the God grace,
Yes.
and our crew, our team member, hard work and effort,
Correct.
and their knowledge,
Correct.
values.
Correct.
Our medical team values, all the patients are not patient now. They are healthy.
They're healthy.
They are healthy.
Yes.
And thanks to God, touch wood, that
Correct.
we doesn't had any casualty.
Correct. And that's what I was coming to.
More than 1,200 air transfers we have done,
Zero
and
fatalities.
0 fatalities
Yeah.
till now.
Yeah. That's a great achievement.
It's a great achievement.
Yes.
And as you know, AM Health Hub and Qulife are partners. So, what makes us different comparing to the other normal medical facilitation company, compared to other normal air ambulance services company? What makes AM Health Hub and Qulife collab makes the difference, add on value to the needy people?
See, whenever there is a medical crisis in a family, it's not just the patient who's suffering, it's the complete family,
The entire family.
who's suffering. And in this scenario, in my opinion, I think two things are of major essence. One is time, how fast, how quickly we respond, and how quickly we can get everything done. Second is safety. So from the safety perspective, yes, during the medical air transfer, Qwiklif takes care of the safety part, but the time is where our partnership comes into action, because there are multiple scenarios wherein we have directly or indirectly saved the life of the patient, even because we were an hour earlier than the others, because of the vast network that AM Health Hub carries. Right. And also the support from the authorities, the government authorities, the embassies, the consulates, the hospitals, that the network that AM Health Hub carries. So I think that's where our partnership carries a major role or a pivotal role.
There are, when a patient is transferred from one country to another country, there are so many myths and misunderstandings are there.
Correct.
It's basically because of the unawareness.
Correct.
Okay. To be honest, this air ambulance service is not a regular word we are using, right? Yeah. This is critical. Critical means very critical time only. This our services come into action, right? Where Qulife is on boarded. So what are the myths and misunderstandings now currently exist, and what advice you can give to the audience for these misunderstandings? So
ideally, I think, or majorly, I think there are three myths that goes into the patient's families, mind. One is it is not at all affordable, or it's extremely expensive. But if you look at the figures, I think over the medical expense over Middle East or in Western countries without the insurance, the medical aid transfer is generally the cost of 1 or 2 nights in an ICU, right? That is the first myth, which I think we need to address, that it's quite affordable if you look at it. Second is that it's not just a fancy plane, or it's not just a fancy setup.
Yeah, not at all.
There are like n number of things, or n number of people's hard work, dedication, time, experience that goes into the complete action of completing a mission from hospital bed at point A to hospital bed at point B. And third, and the most important, the safety part. It's not just like majority of the times we face this, that the patient's family says, please somehow just get out of this situation, or somehow just get out of here and take us back to the hometown. But it's not just something that you can do somehow. It's safety more, or medical priority over the logistical priority. Okay, logistically we can handle things, but without the safety, or by jeopardizing the safety of the patient, we cannot do anything at all.
That means, once this kind of conditions are coming, you are giving the beloved one's life into our hands.
Correct.
And this is our responsibility.
Correct.
This is our priority.
Correct.
To take you to the safe place.
Correct.
Because they need to live a long life.
Correct. Of course.
Some conditions, we are also feel very bad situation. Very young children. Very young people. Recently, I just remember a case from Abu Dhabi. I think you remember that there was one guy who plays football.
Yes.
and he got some major accident. Okay, he was an asset for our country actually. So the bystander, I think his brother called me personally before he see one of my podcasts about this air ambulance service. They called me. They said, "Sir, there is no hope at all. This is what the information they received from the team." So immediately we connected them to the hospital. I need to mention it is in Aster, India. I mean Kochi hospital, and we contacted you. And the same time, our medical crew visited the hospital, and we collected the details. And the next day, we sent them through Emirates to the hospital.
Correct.
And now more than a month, the patient was admitted in the hospital. They had done so many surgeries and blah blah blah. And he called me last week. I never expected a call from the patient.
Yeah.
From the patient.
It's a different feeling.
It's a oh, come on, man. How can I express that?
Yeah.
He called me. He called me and said, "Praveen, this is, I don't want to say the name. This is me. And thanks a lot. I cannot say something more. You guys bring your, this is not us. This is written somewhere. The God only saved him. But we are so proud to be a part of this.
Correct.
We are so proud to be a part of this. So there are, so many conditions are happening. So the people need to be aware what AM Health Hub and Qwiklif can do in the medical.
Correct.
And I just want to add two, three points also. What is the major service of AM Health Hub? The most stressful journey of a person is a medical journey. We go many kind of journey. Our educational journey, our career journey, and for vacations, and medical journey. The most stressful, you need somebody with you is at the time of the medical journey.
Correct.
Because we need someone to assist us, to support us, to guide us, to educate us, and to guide us to the proper doctor, to guide us to the proper hospital, what they need. Because there are so many super specialty hospitals are available in the world. Still, there is no one hospital which have a complete facility.
True.
No hospital have complete. That is at a specialty hospital have. That the patient doesn't know, the bystander doesn't know, but we know.
Correct.
We know. We are trained for that.
True.
Our 100 of crew members, are handling different countries. Even to cover the India also, we have more than 25 people are there.
Correct.
So they know which hospital have which treatment. Which doctor is specialized in that particular treatment. For example, in certain kind of, we recently have one patient for, what is the disease? The finger shivering, what is that? Parkinson's disease. Okay. The patient is from, I forgot the name of the country. Some GCC country. Okay. So they consulted so many hospitals. Uncurable.
Right.
Almost 10-20 years they are treating for this Parkinson's disease.
Right.
We take them to the one country, one specialized doctor, because we know that doctor had done so many this kind of cases, and now he is safe.
Yeah.
I think it is in our YouTube video. We already, if you go to AM Health Hub website or something like that, you can see the patient before condition and patient after condition. Almost 20 years they are treating. Even they don't know what they did for the 20 years. We take them to the hospital for 1 month. He is treated. And he can't even drink water before, When he take the glass of water, his hand is shivering, and now he can put his signature in his hands.
True.
So that means that is the main thing I just want to communicate with the audience, that the people are unaware. Many are aware, but certain are unaware about the medical conditions.
Correct.
Okay? Which doctor they need to be consulted. Even I doesn't know sometimes which doctor, if I have a certain situation, this is what experiences.
Yeah. Correct.
Experience means that doctor need to be practiced on that kind of particular disease. Then only that for doctor also it will be easy.
Correct.
Even certain hospital have their certain diagnostic equipments.
Right.
That equipments can easily be find out that particular disease.
True.
That the patient doesn't know.
True.
So we know that.
Correct.
So if anyone have any support required from the medical side, just contact the number or our website or our concerned team, AM Health Hub. And the main advantages of our AM Health Hub is we are the top one medical facilitator which is approved by the DHA. So Dharshak, we have done more than 1,200 plus air transfer for the last 1 year. So what are the major challenges that you have faced while this transfer?
So the biggest challenge, I'll tell you, what we see is awareness. Which means people or the patient's family members, or generally people to be precise, are not aware that such services, such as the medical transfer or healthcare consultancy services, exist till the very last moment. They get to know about the services in the, you can say, 59th minute of the 11th hour, which means at the very last moment when the patient's condition is extremely critical. That's when they get to know such service exists, and then they reach out to us or through to AM Health Hub, and then of course it's a matter of health and safety, so they take some time to take the decisions. So in this whole process, the patient's condition would have become even more critical, which is even more dangerous for the patient and of course the family. So awareness is the major challenge, and that's where I'm hoping that this partnership and the podcast reaches to the right people, or to the maximum people, and whoever is seeing this, if you could refer to the people who are in needy, that such services are there for your
life-saving help. Actually
life-saving services are there for your help. And even just to add on to that, the medical evaluation or the hospital consultation is absolutely free of cost. We don't charge it. Correct. Neither AM neither Qwiklif does charge for it. So I think awareness is the biggest challenge that we have.
Challenges. Okay. So I just want to add on one point with what Dharshak said. As you said, that many people are not aware about this, and last moment only they are checking about what is the last stage of transferring this patient from one hospital to another hospital. Just remember that this service is not that much expensive as like everyone thinks. Air ambulance, air shifting, like medical patient transfer, starting from a range of, I think, 15,000 dirham.
15,000.
Or it will go to 25,000, 30,000, depend upon the patient condition and the destination, as well as the availability of the commercial flight.
Correct.
Even if it is a private jet case, okay, it will be certain expensive. But in commercial flights, this is not that much expensive at like what you are all thinking. And always take a decision in advance, like if the patient go to a critical stage. And many patients are having financial issues. Sometimes if they stay in the ICU for 2-3 days, their insurance coverage will be finished, right? So on that cases, what they do, they don't know about these facilities are available.
Correct.
On that case, what they do, they will stay 2-3 days more.
Yes.
That will cover maybe 50,000, 100,000.
100%, yes.
But if they take a decision of transferring this patient to their own country for a cheap treatment or a better treatment, you can contact AM Health Hub. Our contact details are available, and we are an associate with partner with Qulife, and we together done more than 1,200 plus safe transfers without any fatality cases. Touch wood to the God.
Yes.
We have done that, and we have a specialized, experienced crew, medical team behind this one.
Correct.
So it's a time to wind up the session, and I hope the viewers got an idea about what air ambulance services are there, and what are the facilities, what are the technical terms, what are the commercial terms we can provide to the people. So once again, thank you for tuning in. And if you have someone you love or ever faces a medical crisis where time, distance, and critical care need to come together, remember this: AM Health Hub and Qulife are here to carry you through it. And until next time, stay safe, stay informed. And as I always say, your health is our priority. Thank you so much. Thank you so much for your time for viewing this informative session. Thanks a lot, Dharshak, for being a part of this.
Thank you so much for having me.
Honored. Thanks a lot.
Thank you.
Bye.
Bye.
Take care.